I started coming to Dr. Stitik's. It's really hard to learn on your own and not get, helpful tips and pointers, which these courses with Dr. Stitik has been invaluable for.
Anyone coming here at all levels, whether it is a medical student, resident physician, or practicing physician, there's always something that you can take away from these sessions.
Because of the technology that's now available, I think we're able to offer our patients new ways of treatment, maybe better ways of treatment that can give longer lasting relief than just your typical cortisone injections.
These meetings that we run for musculoskeletal ultrasound are really a series of events that combine some didactic material, hands-on scanning by the participants, and some demonstrations. The didactic material also includes injection procedures that I had performed over the years on actual patients. We divide up the whole series into different regions: shoulder, then elbow, wrist and hand, and then one devoted solely to upper limb injection procedures. Then the second half of the year, we cover the lower limb, so hip, knee, foot and ankle, and then lower limb injection procedures. My background is I'm a physiatrist. I specialize in musculoskeletal medicine. I use ultrasound as a very big part of my practice, both for diagnostics and injections. And that's what we really teach: the value of musculoskeletal ultrasound to help with patient diagnosis, and then also to help with treatment. So the attendees at these events include all the way from medical students all the way on up to other attending physicians. So there'll be medical students, residents, fellows, and attendings. And the value for the medical students, they're introduced to the whole concept and they get an idea of what does a physiatrist, a PM&R doctor, do in the outpatient world. On the opposite end of the spectrum, the attending physicians who are already aware of that, and most of them are already using ultrasound, what the value they get out of it is what are some of the newer procedures and newer diagnostic algorithms that are used. And then in between are our residents and our fellows, and they get further explanation of what musculoskeletal ultrasound really is. And then in the case of the fellows, they're going to be attendings pretty soon. So they start to really expand upon the skills that they've already developed. So there's really something for everyone. By coming here, they can expect to really get a quality education from it. Particularly if they participate in all of the series or almost all of them, they'll really get a good look at musculoskeletal ultrasound. The fact that they'll see it scanned in the demo and then do hands-on scanning in a small group setting. The ultrasound probe is being passed around frequently. They'll get a lot of hands-on experience. They're free to ask questions. And then we've also added, at lunchtime, we're doing a plain X-ray radiology series too. How can we use X-rays to help us with ultrasound, the interpretation of ultrasound, etc. They'll get to network too. So in the case of medical students, many of them are trying to get into the field of PM&R. And it's great that they're actually going to be rubbing elbows literally with residents who are in some of the programs they're applying to, the fellows, attending physicians, and we even have today's event, we had 2 program directors too. So that's the expectation for them. The residents are often seeking fellowship, so in the same room are going to be fellows in various programs. They'll get a chance to speak to them. And a fellowship, there was a co-director for a fellowship was there today, so they would get a chance to potentially interface with them. For other attending physicians, the expectation, besides learning new procedures, they'll be able to interact with colleagues, bounce ideas off of, etc. So really, again, something for everyone. I'm pretty excited about the events. I really, really enjoy them. Been doing them for a while, and over time we've modified the material as needed. Today we taught 2 newer procedures that hadn't been taught before, at least in this venue, so I look forward to that. Our next one is going to be the elbow, and what one would expect from that is updated information on ultrasound of the elbow, didactic information including injection procedures, the scanning demo again, the hands-on scanning that they do, and all the other interactions with various people in the room. So I really would encourage people to come to the next one, and in fact, really the whole series.
The most important thing is actually the exposures and the hands-on training. Very patient with us and show us one by one how to approach the ultrasound and different views, different angles.
I think it's the hands-on time that we get to spend with the trainees. We break up into small groups, and it's nice where I can ask one of the staff here, can get an extra ultrasound machine, and we got an extra one 10 minutes up and running.